Hey everybody, I meant to show you guys the RetireFlo program that was going to be doing a webinar on a few weeks ago. I meant to show that to you today too, and got a little long-winded and forgot to do that. But I figured I would make a video here just showing you how it works, to walk through the process. I still am not sure if I'm going to use this or not. It's definitely still on the table to use it. One of the main features that I like on this versus the planned enroll is that when you send this link to a member, the member does not have to log in or make a login of any kind to do this. They fill their information out and it gets submitted back to you. But I'm going to show you guys how this works. So it's retireflo.com. When you log in here, you go on here, and to make a survey, it costs a monthly amount for each new survey that you create on your account. Okay, and I'm not really going to go through the steps of making the survey and everything, but I just want to show you guys what it looks like on our end and what it looks like on the members' end when you send a survey to somebody. Okay, so this right here is a link that I made for us to be able to send out to our members. You can see here we've had 4 submissions and 5 downloads, but so we're going to click view page. This is a look at what the member gets when you send them the link. Okay, and the link is this right here, the RetireFlo / the Davis Insurance Resource. Copy that link, and then you can add that link to an email, a text message, however you want to do it. On our Android phones, it pops up a very nice picture of the RetireFlo and all this kind of stuff when you send a text message out, so it's not just some big jumbled mess of whatever. It looks legit. But anyway, if you click the view page, this is what would pop up again when the member clicks your link. Okay, and then when they click get started with what this says Davis Insurance, you would put your name on it, and over here where we've got our logo out would actually be your picture. You could put that in there. We're going to say get started, and so it's very flowing and easy to use, but it's it says hey there, and that would be your agent's name. This is all the disclaimers and this kind of stuff. This is all CMS compliant. They have absolutely gone through and done everything that's supposed to happen with CMS. Okay, this is going to capture a consent to contact for you, and you're going to be able to capture a scope of appointment at the end of this thing too. Okay, so we hit let's go. So it asks for their email address. Okay, if they don't want to put an email address and they click OK, it'll take them to the next page. It's fine. So actually, I'm going to go and not worry about the email address. When they click OK and they don't, it says, we notice you didn't complete the question. Just a reminder, we're asking questions to thoughtfully provide you plan options in your area. Go back or continue. If they hit continue, takes them to the next one. How familiar are you with Medicare? We'll just say a little familiar, but don't know where to start. Ask them their name. Hopefully they'll put their name in there. If they'll at least put their name in there, and not their email. There's a place to put their phone number and stuff here in a minute. But anyway, let's get started. Current health insurance. Want to know what type of plan you're currently on. So say I'm already on Medicare. What kind of Medicare plan are you on? I don't know. Medicare supplement, prescription drug, Medicare Advantage. We'll say Medicare Advantage. It asks their address. They don't have to put the address, but if they want to, they can. I'm just going to put our office here. As you can see, it started pulling it up and it'll automatically populate it. So there's the address. Your preferred pharmacy. So if they put their address in here when you click search for pharmacy, it automatically puts the zip code in there. Okay, so here's the Walmart pharmacies that's in the area, which this is going, I mean, it's pulling them up, but it's just listing them the closest one to the zip code, but it's pulling them up all the way into North Little Rock and that kind of stuff. But let's just say we use the neighborhood market pharmacy that's over on Prince by our office. We'll say that's our pharmacy. We're going to click OK. Take a look at your current prescriptions. And this uses, when we're adding the prescriptions here, this uses the Connecture platform that is, if you're using the Medicare app in the Medicare Center for doing your enrollments and that kind of stuff, that's the Connecture platform. The other one that's on there is the Sunfire platform, but this is actually using the Connecture platform to be able to look up the prescriptions and stuff. So I'm gonna go with metformin. So you type in metformin, the metformin HCl, that's your typical one, and then you get to pick your dosage and stuff, or the member would. Okay, so we'll say they take 500 milligram. We'll say they take it twice a day. We'll say that's all they take. And it's asking for them to review to make sure their prescription information is correct. It's very important to provide plan options in your area. All of my information is correct. This is saving your butt right here because they are saying, hey, this information is correct. And so if it's a misquote on the drugs and stuff, man, we don't want that. But if it is a misquote on the drugs, it's saving your butt if they file a grievance or something saying that we didn't tell them that that drug was going to be such and such. Well, you didn't give me the right drug, okay? Still, it's protecting your butt. We don't want the wrong drug in there, but it is protecting you. So your doctors. So hospitals, it's going to have every Medicare, we'll say that ain't the word I'm looking for. We'll just say Medicare contracted hospitals across the country. If you type it in here, it will populate it. But let's just say we've got Conway Regional. So Conway Regional. Let's add another one. Let's say Baptist. You do have to know how the hospital is actually named, to pull it up. But anyway, you add that in there. Your primary care physician. This one right here is not going to look it up. It's just you want to make sure that they're hopefully spelling the doctors correct and everything. But there's the primary care doctor. We'll say Joe Schmo. Specialist name. We'll say Joe Smith. I don't know. And we'll say this is a cardiologist. Let's say that's all the doctors. Tell us about your preferences when it comes to your Medicare plan. And so it's select your option which best suits you. I don't mind paying co-pays for medical services in exchange for lower monthly premiums, or I'd prefer to pay higher monthly premiums in exchange for little or no out-of-pocket costs for medical services. It pretty much helps decide whether to send them down the Medicare Advantage path or the Medicare Supplement path. And then do any of these apply? I love this question here because I can't tell you how many times I've been in an appointment and I'm 20-30 minutes into the appointment and plugged in drugs, plugged in doctors. They're ready to, look at a plan. Maybe I've already showed them a plan and they're like, hey, well, then I find out during the enrollment process when I'm asking, are you a veteran or do you have, drug coverage anywhere else through like the VA or whatever? And they say, oh yeah, I've got TRICARE, and I'm like, nice. I wish I'd have known that at the very beginning. But are they, federal retirement, state teachers retirement? Are they TRICARE? Are they just simply a veteran? These are all questions it's good to know on the front end that sometimes it's hard to remember to ask these. We're just going to say none of these apply. Your phone number. You probably got this person's phone number, so they're probably going to give you their phone number. And your age. It's not going to ask their date of birth because CMS will not allow on something like this for them to ask their date of birth, but they can't ask their age, so we'll just say this person's 65. All right, and so it says let's wrap this up. and it's talking about the Centers for Medicare and Medicaid Services require agents to document the scope of a marketing appointment prior to any face-to-face sales meeting, okay? Y'all have all heard that disclaimer before. That's because we're about to go into the scope of appointment. This is the easiest scope of appointment I've ever seen for somebody to fill out and send back. All they got to do is go down through here. Standalone drug plans, put your initials there. Medicare Part C plans, they put their initials there. Medicare supplements, put their initials there. Ancillary products, like hospital indemnity plans, dental, vision, whatever. And then they just pick their signature, how fancy they want it to look. Sign and complete it. Alright, they're done, okay? Now, once they submit that, you go back into your portal, into your submission center, and this is everything that where somebody has submitted this survey to you. This one right here is the one that we just done, so we're going to download this. And this is what you get right here. So as you can see, it's got their name, their age, their address, what county they're in. If they added an email address, it would be right there. There's their phone number. Tells you what page that this came from that you sent. Here's their questions: how familiar are with Medicare, current health insurance they're on a Medicare Advantage plan. Their preferred pharmacy is a Walmart pharmacy. Their drug they take is the metformin. That's all we put in there. I want to something that's cool though about this. Everybody's probably familiar with the Advanced Diabetes Specialist, which is kind of the concierge service for somebody who is diabetic to get their diabetic supplies and that kind of stuff. And ADS was always asking us, to refer our members to them and this kind of stuff, which I think is a good thing, because any communication they have with our members, it'll have us on there as their agent and that kind of stuff. But if somebody is taking a diabetic drug like metformin, it's going to have this little certificate thing or whatever you call it right over here to the right, and you can click right here to learn more. It takes you straight to the ADS page, and you can scroll down here and you can put that member's information in here to get them connected with ADS, and then ADS will reach out to them to help them get their diabetic supplies and that kind of stuff from ADS. So that's pretty neat. There's their hospitals, their physicians, and whether they mind having a plan that has co-pays, or whether they want no premiums, whatever, this kind of stuff. And then here's your scope of appointment. So this scope of appointment is filled out here. There's their signature. Your part of it is not filled out, okay? But if you ever got called by a carrier or someone saying, hey, I need to see your scope of appointment from July 24th, with the member blah, 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 blah. Well, then you go in here and you print this out and you fill this information here out. Right here, you fill it out and then send it into them. So there's your scope of appointment. So you got a scope of appointment, your consent to contact. If this is sent to your current members, like this can be sent out to your current members right now before AEP, because if you're not aware, a scope of appointment is now good for 12 months. So you could be sending this out to update your members' prescription drug coverage, their doctors, all that kind of stuff. And when they submit it back, now you've already captured your scope of appointment that you're going to need for AEP. All you got to do is simply meet with them or help them, over the phone. Maybe you're going to send them a link to a plan for them to enroll themselves on, whatever. But you've captured their information. Of course, you got to take this and put it back in your Medicare center, to update their file and that kind of stuff. But it'd be much easier to, if you get 100 members that responds to this, it'd be much easier to print out 100 of these forms and sit down and plug it all in than to try to call 100 people to get all this information and get it updated, or mail them something and hopefully they'll fill it out and mail it back and that kind of stuff. But this program right here, RetireFlo, in my opinion, it's going to be hard to beat, and for me to not be using this. I've got a couple members here that are legit people who sent this back to me when they called, wanted to set an appointment. I found out if their phone number was a cell phone for sure. And if they said yeah, then I said, hey, I'm going to text you a link. And on this link, and explain what it is, tell them, hey, it's just going to ask you to fill out some information like your prescriptions, your doctors, and this kind of stuff. And tell them that, this will just help, kind of help speed the process along, when we meet up. And save you from having to bring your prescriptions or a list of your prescriptions or doctors or blah, 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 and then you've already got that. You can go ahead and make them a file in your Medicare Center or whatever you wanted to do. Have all that in there, and when you sit down with them, you just simply type their name in and pull them up, and here they are. This is going to be very helpful, though, in my opinion, and something like this, whether it's using this or whether it's the Plan Enroll program, which there are some significant changes they're making to it. We may be able to use that and not have to do this. But this right here, if you go back and find that original email that I'd sent to you guys a few weeks ago for the webinar that I was going to do on this, there is the discount code that you can use to get the cost of this down to the $29.99, because if you go in there and you make an account, they're going to want to charge you $49.99 a month for it. And again, realize that they're going to charge you that $29.99 for each link that you make. Okay, so you'd want to make you just one link and use it to send to your members. If you wanted to make multiple links, you could. They'll charge you for each month that you have that link up, but if you delete that link after you're done with it, they're not going to charge you again. So if you wanted a couple different links, you could. Just know that you're going to be paying that fee each month for each link that you have, okay? So, but with that being said, this is a pretty neat platform here, and the main thing I like about it is that there is nothing that's requiring that member to make an account to log in, and they don't have to give any information that they don't want to. Like, they don't have to give their email, they don't have to give their address, they don't have to give their phone number. If they'll give their name and send you all that information, that would be enough, because you probably got a phone number. You've probably already got an appointment set with them, and if they're your members, and you've probably got their address already. But it's not a pressing or it's not intimidating, making the member feel like you're just trying to grab their information to be able to call them up and sell them something, or sell their information or whatever. So anyway, if you guys want to use this, you can go to the RetireFlo.com, and when you sign up, just pull that email up that I had sent a few weeks ago that had the discount code on it, and that'll get the price of this down to the $29.99 instead of the $49.99 a month like it regularly is. So if you got any questions, give me a holler. I'd be happy to walk through it or answer any of those for you.